Thank you. Thank you for joining us for this briefing on COVID-19 and our local response to prevent the spread of this disease. Joining me again is interpreter Margie Propp, and thank you so much, Margie, for being here to provide your services. And thank you to the media for covering this briefing, and to all the residents who are tuning in to learn more about how you can protect yourself, your loved ones, and our community during this pandemic. We want to remind you that you can also get information at our website, covid19.lincoln.ne.gov. There you can find our data dashboard that provides more detailed information on our investigations of cases here in Lincoln. We regret to inform you today that another one of our community members has passed away from COVID-19, bringing Lancaster County's death toll to 3. Nebraska as a whole has now seen 101 people lost to this terrible disease, and we feel these losses tremendously, locally and in our communities across our state. And on behalf of the City of Lincoln, I offer condolences to all those who are mourning a beloved family member, a friend, a coworker, or a neighbor. And here in Lincoln today, we have had a total of 18 individuals test positive for COVID-19. We reported earlier this morning that 2 individuals had tested positive, and since that time, another 16 individuals have been diagnosed. The total number of lab-confirmed cases in Lincoln now stands at 665. Here to share more details about the Health Department's investigations on these cases is Health Director Pat Lopez.
For some time, we have been providing COVID-19 updates and updating our online dashboard twice a day. Starting tomorrow, we will be moving to 1 report per day in mid-afternoon. The information we provide at this daily briefing will be the most current. We have found that providing one number in the morning and another number in the afternoon has caused some confusion, so we hope with our new reporting system we will alleviate some of that. At the same time, the public needs to realize that different organizations have different practices for how they report data. For some report provisional data, while others require confirmation. Our health department requires confirmation. For these reasons, numbers may differ slightly from other sources at various times of the day. We take this responsibility very seriously and would rather report at the point in time when we are sure of accuracy. We continue to have 27 active contact tracers. The largest area of concern remains the Smithfield Plant and Crete in the neighboring Saline County. Our contact tracers investigations have now identified 236 Lancaster County residents who are positive cases related to the plant. 149 are employees at the plant and 87 are family members or direct contacts. The cases related to the Smithfield Plant and Crete represent 35% of all lab-confirmed cases of COVID-19 in Lancaster County. We have no new cases to report at our Lancaster County plant. The smaller Smithfield plant in Lincoln remains at 10 positive cases, and Smart Chicken in Waverly also remains at 10 positive cases. Bryan Health and CHI St. Elizabeth completed 389 tests at their various testing sites, which include hospitals, their urgent care, and drive-through sites. Again, if you have symptoms of COVID-19, we urge you to get tested now. Please visit chihealth.com or bryanhealth.com to begin the process. Test Nebraska is also now testing in Lincoln as well. For more information on that testing option, you can visit testnebraska.com. The overall positivity rate in Lancaster County is down from 9.8 yesterday to 9.5% today. The state rate is 18% and the national rate is 17%. Today, our local hospitals report 47 COVID-19 patients. That includes 21 Lancaster County residents and 26 from other parts of the state. 10 patients are on ventilators, and that includes 5 from Lancaster County and 5 from other parts of the state. Hospital capacity in Lincoln remains healthy. Tomorrow we plan to share more data on demographics as well as the recovery data that we've been able to compile. As this pandemic has progressed, we continue to learn more about the virus and how it is spread. One of the most concerning factors is asymptomatic carriers, those who are COVID-19 positive but don't really know that they have the disease because they don't have symptoms. It's important for all of us to understand that anyone we encounter could spread the virus. And we need to realize that we can be an asymptomatic carrier and our interactions with others could spread the virus to them. That's why we continue to urge everyone to wear a face covering anytime you're around other people. That prevents the chance of droplets from becoming airborne and spreading COVID-19. I want to thank Bryan Health, CHI St. Elizabeth, and those in the Lincoln Healthcare Network who are pushing this message. The message is simple: be a hero, wear a mask. At this past Friday's briefing, Dr. Johnson, a pulmonologist with Bryan Health, did a very persuasive job of explaining why it's important to wear a mask or face covering. This graphic shows how wearing a face covering can greatly reduce the chances of spreading the virus. The Health Department and the Lancaster County Medical Society are working together to promote this message through public service announcements and social media. Our COVID-19 website is a great resource for more information about face coverings. Just visit covid19.lincoln.ne.gov and click on the How to Help tab. You'll find answers to frequently asked questions, face covering information in multiple languages, and links to learn how to properly put on and take off your face covering. There are even instructions on how to make face coverings for yourself and others. Wearing a face covering is an important part of our battle plan against the virus, but it is just one precaution. Remember, stay home as much as you can. Wash your hands often and thoroughly. Avoid touching your face, especially your eyes, and stay at least 6 feet away from others. Do it for yourself and for your community.
Thank you, Director Lopez. We appreciate those important public health and safety messages. and want to reiterate that the best way to prevent the spread of COVID-19 is for all of us to follow that kind of guidance coming from our local public health experts. That's why it's so important that every resident, no matter what language they speak, can easily access accurate and timely information about how to protect themselves and others. Today, we'll be discussing our collaboration with Lincoln's Cultural Center Coalition to provide testing and important health messages in a variety of languages. The Health Department, Bryan Health, and our Cultural Center Coalition are partnering to provide a free testing opportunity for residents who are experiencing symptoms of COVID-19. An additional testing site will be available at Lincoln High School this Friday, May 15th, between 4 p.m. and 7 p.m. If you are interested, we ask that you register in advance by getting in touch with your local cultural center or by calling the Lincoln Lancaster County Health Department's COVID-19 hotline at 402-441-8006. When you call, a nurse will ask you about your symptoms and gather a few pieces of information, including your name, date of birth, address, phone number, and your preferred language, and then you will be scheduled for a free test. At the testing site on Friday, interpreters will be available to assist you in your preferred language. If you test positive for COVID-19, the Cultural Center Coalition and the Health Department may be able to provide care packages with resources needed to help you stay in quarantine or isolation if necessary. For more information, call the Health Department's hotline. Again, that number is 402-441-8006. And if you're not able to get tested on Friday and are experiencing symptoms of COVID-19, you are still encouraged to seek testing. At every testing site, interpretation is available in partnership with our local health department. I want to give a special thank you to our Cultural Center Coalition leaders who have collaborated with us to make this event possible. Sheila Dorsey Vinton from the Asian Community and Cultural Center, John Goodwin from the Malone, Eva Ayala from El Centro de las Americas, Suzanne Mealer from the Ponca Tribe of Nebraska, and Tom Randa from the Good Neighbor Community Center. They're all here with us via Zoom today, representing their organizations, and we are tremendously grateful for their partnership and their leadership in protecting the health and safety of our community. We've invited each of them to share important messages with us today, and first up is Sheila Dorsey Vinton, Executive Director of the Asian Community and Cultural Center. And with that, Sheila, over to you.
Greetings, everybody. The Asian Community and Cultural Center is happy to be a part of this team-wide effort to get the messages out to all of our community members. And I'd like to introduce you to some of our staff that will be assisting you in your languages. And so first I'd like to introduce Rebecca Reinhardt, and she will provide a message right now in Mandarin Chinese.
Hello everyone. 我现在用中文把刚才市长说的几点告诉大家。第一，必须认识到接受测试的重要性。如果你认为自己曾经接触过患有新冠肺炎的人，或者可能患有新冠肺炎，例如一个家庭成员的测试结果呈阳性，应该对其他家庭成员进行测试。第二，认真对待戴口罩仪式。第三，洗手，继续保持身体之间的距离。第四，测试时间、日期、地点：5月15号下午4点到7点，在林肯高中南面停车坪。第五，提供翻译。第六，请留在自己的车内。第七，必须提前预约好，用你常用的电话拨打卫生局电话402-441-8006。第八，只需要提供你的姓名、生日、家庭住址、电话号码和首选语言。谢谢。
Thank you, Rebecca. I'd also like to introduce Lynetta Edison. She will provide a message in Karen. Popo, please turn on your microphone.
Hello, Yamila Popo no. Tani ngay ni yikete ba khalo hung ba khata suta sa khar khai no. Awe third boni no. Pemisinya lo besalo pe let koplowa pala oda ta sa kha minimi ba le bi pu kopo degagi. Oda ta sa kha ni. Awe mita rido le hung negasiwa na sa no. Awe hung arido ketele negasiwa na sa. Lalu ni agatemina thabo ne bela bedon ta lalu ne kabari ga ne meta lalu ne hu awe agatemini thabo ne tin su mama no tin su blog awe mini aseka kisi lalu awe kani ne bu odo hu pala ke si pala muta si wa sa no ta lo le awe ba ke si wa sa ne ke weda phe la medisi ye to lunari tu le lunari le hu awe high school to no local awe high school ni likan high ni no awe pen ni pala sigwa sa ni awe ora ba klo thida la de wo blood ni ga temini naga ba ola naga pu blood awe naga ba ko fo lo blood ba ka naga ba schedule ga appointment fo na gi naga ba ko lo ta so clear law weather lui wa ki lui de ko wa khu oda nga ba nemi ko phone oda nga ba hilon nemi no plan ni lalu na otala na address lalu ne hun klo ke awe ta ga to le nga te klo le menu le mo no nemi te ba ga nyo le te le lo ba ga nyo klo ye ni no lalu ne thabo ne ka ba ola ta blo ba do pa te sinya ba le hun me de ga le a cho ri ga ta su ta cha kha le no mo no a ko ne mi ha ro le ba kla mi ri ne mi le le ta lo pu ye mi ri ne thabo ne ka ba ri ga ne me lo ne o cho ju da ba ga nyo a chu ga te hu pi no mi table.
Thank you, Popo. And next we have Dui Linh Bui, who will provide the information in Vietnamese. Thank you, Linh.
Xin chào mọi người, tôi xin cung cấp một số thông tin cập nhật về vấn đề xét nghiệm COVID ở tại địa phương của chúng ta. Trước hết, quý vị cần phải nhận biết sự quan trọng của việc xét nghiệm. Nếu quý vị tin rằng mình có tiếp xúc với người nhiễm bệnh hoặc là tiếp xúc với những người mà có khả năng sẽ bị nhiễm bệnh, ví dụ như là một thành viên trong hộ gia đình mình đã xét nghiệm dương tính với virus hoặc là mình có tiếp xúc với những người nào đó đã nhiễm virus thì những thành viên khác trong hộ gia đình cũng cần phải được xét nghiệm. Quý vị cần phải hết sức cẩn thận về việc mang khẩu trang, vệ sinh, rửa tay và tiếp tục giữ khoảng cách với khi mà mình phải tiếp xúc với những người khác. Ngày giờ và địa điểm xét nghiệm là vào thứ Sáu này, ngày 15 tháng 5 từ 4 giờ tới 7 giờ chiều tại bãi đổ xe của trường Trung học Linh Cần 2. Sẽ có phiên dịch nếu mà quý vị cần. Khi mình tới địa điểm xét nghiệm thì mình chỉ cần ngồi trên xe. Để được xét nghiệm thì mình cần phải lấy hẹn. Nếu quý vị có chỉ nói tiếng Việt thì quý vị có thể gọi số 402 809 2279. Tôi xin nhắc lại, nếu quý vị chỉ nói tiếng Việt thì có thể gọi số 402 809 2279 và vui lòng để lại tên và số điện thoại. Sẽ có nhân viên nói tiếng Việt gọi lại cho quý vị để giúp quý vị lấy hẹn. Hoặc quý vị có thể gọi thẳng đến số điện thoại của Sở Y tế địa phương 402 441 8006. Khi quý vị gọi đến số điện thoại của Sở Y tế địa phương thì sẽ có người hỏi quý vị về một số triệu chứng và quý vị chỉ cần cung cấp tên, ngày sinh, địa chỉ, số điện thoại và ngôn ngữ mà quý vị cần giúp đỡ. Xin cảm ơn.
Thank you, Lynn. And again, I just want to reiterate that the Asian Center is happy to help everybody who has a language barrier in accessing these services and this testing, but also anywhere where you feel like you need some assistance, our staff are very happy to help you. Thank you.
Thank you so much, Sheila. And next, I'd love to invite John Goodwin of the Malone to share a few words.
Thanks, Mayor. I appreciate the opportunity. We're very grateful at the Malone and our partnership and collaboration with the culture centers. Just want to iterate what Dr. Pegg, the director Lopez said briefly. In washing our hands, our community just be on board with just washing hands and covering the mouth around people, staying that safe distance, making sure we're drinking plenty of water. What we don't hear in our community is making sure we're taking vitamins and minerals, the correct vitamins and minerals to help our immune systems, boost those immunes to where we can be able to fight off viruses, not just the coronavirus, but the flu and the colds and everything else that's going around. So we're really trying to push our community in getting the proper vitamins and the minerals that they need, as well as practicing the safe distance and being able to wash our hands consistently. We are encouraging our community as well for if you are experiencing symptoms of the coronavirus to get tested at Lincoln High. What a great high school to be doing testing on the 15th of May, 4 p.m. to 7 p.m. So we are encouraging our community, if you are experiencing symptoms, to please go get tested. That's very important for us. And like most of the community, I want to watch some football this year. So the way that we can really get that to happen is that we abide by the rules and regulations that the state is providing us to make sure we're doing the proper and taking the proper steps in making those things happen and to be safe.
Thank you so much, John. And I appreciate the shout out to Lincoln High. I feel like we should say go Lynx while we're at it. Joining us next is Eva Ayala, representing El Centro de las Americas.
Thank you, Mayor, again.
Thanks for coming back.
Debemos reconocer la importancia de hacerse la prueba del COVID, especialmente si ha estado expuesto a alguien que posiblemente tenga COVID o si están presentando síntomas del COVID. Por ejemplo, si un miembro de su hogar ha dado, los otros miembros del hogar deben ser evaluados. Los síntomas son tos, falta de aliento y dificultad para respirar, fiebre, escalofríos, dolor muscular, dolor de garganta y nueva pérdida del paladar o el olfato. Este viernes 15 de mayo, de la escuela Lincoln High School, se estará haciendo pruebas del COVID-19. Usted debe llamar al Departamento de Salud 441-8006 para hacerse una cita. Una enfermera estará disponible para tomar y ayudarle en el proceso. La información que le pedirán va a ser su nombre, fecha de nacimiento, su dirección y el número de teléfono con su idioma preferido para poderlos contactar para el proceso del seguimiento. Definitivamente tenemos que seguir manteniendo las recomendaciones para detener la propagación, y es quedarse en casa si está enfermo o si alguien en su casa se encuentra enfermo. Lávese las manos con frecuencia y 20 segundos. Y siempre compre su despensa una vez que salga solo cuando sea necesario. Definitivamente mantener la distancia con cualquier persona que no viva con usted y cúbrase la boca y la nariz con una máscara si es de que tiene que salir. Definitivamente tenemos que seguir continuando y hablar con la comunidad y pasar la información de que si está teniendo síntomas o si presenta o si siente de que alguien en su familia o algún familiar, amigo, está presentando los síntomas, definitivamente contactarse con el centro o con el Departamento de Salud al 402-441-8006 para detener la propagación. Gracias. Thank you, Mayor.
Thank you, Ava. And next up, we'd like to welcome Suzanne Mealer, representing the Ponca tribe of Nebraska. Thanks for coming back to be with us again, Suzanne.
Thank you, Mayor. On behalf of the Ponca tribe of Nebraska, we are honored to be part of the COVID-19 additional testing sites that's provided by the Lancaster County Health Department and Bryan Health. We want to make sure that we're reaching all our Lancaster County population that are showing signs and symptoms. And with that being said, we must recognize the importance of being tested. If we believe we have been exposed to someone who has COVID or potentially has COVID-19, for example, if a household member who has tested positive, then the other household member should be tested. And we want to be conscious about wearing face masks and coverings, just like John Goodwin said. Wash hands, continue to use physical distancing. The testing time and dates, May 15th from 4 to 7 at Lincoln High, and it's on the south lot of Lincoln High. And then just know that, you know, the folks that are doing the testing, they want to make sure that everybody stays in their car. You know, no walking up to the site if you can get a car to get over there. But by scheduling, you can call the County Health Department at 441-8006, or if you need resources through the Ponca Tribe, you can contact us at 402-438-9222. And then, you know, to be very clear, we want to make sure that all you have to do is provide your name, date of birth, address, phone number, and preferred language. Thank you.
Thank you so much, Suzanne. And next up is Tom Randa from the Good Neighbor Community Center. And he is also, of course, one of our devoted volunteers and serves on our Lincoln Lancaster County Board of Health. Thank you for that service. And over to you, Tom.
Thank you so much for the opportunity. I want to also thank our staff members from the cultural centers and all they're doing, the health department, and Brian for the partnership. So that we can be able to get us back to better lives that we usually had. I'm going to emphasize on most of the barriers that the people we serve are facing. And one of the things that comes into mind is cost. Most people are asking, how am I going to cover those, the cost? And we are here to emphasize today that it is free. You're not going to pay anything, because we know that's one of the barriers that is stopping you from getting tested. So if you have those symptoms and you're worried about money, it is going to be taken care of. If you need a referral, call the number we've been emphasizing today, 402-441-8006, to get scheduled for testing on Friday. And the other thing is, what if you get tested and you're positive? We want to make sure that you're at ease, because the cultural centers are working together to make sure that if you're in need of food, it's going to get delivered to you. And like the mayor said before, there's going to be a care package also that's going to cover most of the things that you're going to need while you're in isolation or quarantine. So we want to make sure that that's not an issue. We will take care of that. The cultural centers are here to make sure that's taken care of. I'm going to introduce one of our staff members here, Tariq. He works with the Middle East, North Africa Hope Project, the Middle Eastern population. And I'm also going to emphasize also that the Asian Community Center also has someone that speaks Arabic. So if you call the two agencies with that language, we should be able to assist you between us and them. But you may see Tariq being one of the people that will be bringing food to your doorstep in case you end up testing positive. So it's a familiar face. He's going to be covered, so you might not see his face, but we want to make sure to know that he's going to be one of the people that's going to be assisting you. So here you go, Tariq.
Hey everybody, السلام عليكم. نظرا لأهمية الفحص لفيروس كورونا وبالتعاون مع مديرية الصحة والخدمات الإنسانية، نرجو من جميع الأشخاص الذين خالطوا الناس اللي بيهم فيروس كورونا، وكذلك الناس اللي يظنون أنهم عندهم أعراض للكورونا، التفضل بالذهاب إلى مدرسة لينكن هاي في القسم الجنوبي من البارك لإجراء الفحص والجلوس في سياراتهم فقط، وبإمكانهم فقط الاتصال على الرقم التالي 402-441-8006 لأخذ معلوماتهم الرئيسية حتى يسجلوهم للذهاب هناك. الموعد هو يوم 15/5 يعني الجمعة القادمة من الساعة 4 إلى الساعة 7 مساء إن شاء الله، وكله مجانا، ما يحتاج يكون عندك كوميونيكيت ولا يحتاج عندك يكون تأمين صحي. المهم سلامتكم، على فرض انه اي شخص راح يكون عنده لا سمح الله اصابه، راح يكون ينحجز بالبيت مع عائلته جميعا ويسوون الفحص هم كذلك. ولكن اطمئنوا، راح قسم الصحه وكذلك بالتعاون مع جميع المراكز الثقافيه والاجتماعيه راح نوصل لهم الى بيوتهم جميع الاحتياجات الطبيه والغذائيه. المهم السلامه. شكرا جزيلا. تسلم. Thank you.
Thank you, Tariq, and thank you, Tom, and thank you to each and every member of our Cultural Center Coalition for your incredible efforts to keep all of our residents healthy and safe and connected during this really challenging time. And knowing how important it is to reach everyone who calls Lincoln home, we have taken other steps as well to overcome barriers our community members may face in accessing information about COVID-19. First, we have invested in providing interpretation of our press briefings, not only in American Sign Language, but in other languages as well. And so beginning back in April, we began translating one of our press briefings per week into Spanish, Arabic, and Vietnamese, the three most commonly spoken languages in Lincoln after English. The audio of these briefings is available on our website 1 to 2 days after the press conference is held. And to access these briefings, you can visit covid19.lincoln.ne.gov and click on the Resident Resources tab. And second, in collaboration with our Cultural Centers Coalition, we've produced PSA-style videos in Spanish, Arabic, Vietnamese, Chinese, Karen, and Kurdish Kurmanji. And in these videos, community leaders share 6 things residents need to know to protect themselves and others from the virus. And the city and our cultural centers have shared these videos with community members via social media. And I just want to say thank you once again to our cultural center leaders for your generous collaboration in producing these videos and sharing them throughout our community. Every resident, no matter who they are or what language they speak, brings tremendous value to our city. The foundation of One Lincoln, our initiative and belief that diversity and inclusion are the strength of our community, is especially true during challenging times like these. And now we have some good news to share. Yesterday, we unveiled the COVID-19 risk dial that's now available on our website at covid19.lincoln.ne.gov. That color-coded dial calibrates the risk of COVID-19 spread locally and provides specific guidance for the public on how to protect themselves and others and to prevent the spread of the virus. We were thrilled to discover this morning that since we launched the dial yesterday afternoon, the website has had the most one-day traffic since March 25th, which is when we announced our first directed health measure. Our website has had over 10,000 unique page views, and we, of course, attribute that many folks were checking out the dial yesterday and early this morning. The best part about what this says to us is that the people of Lincoln, our residents, are staying informed. They are taking this virus very seriously and are looking for the best guidance available. COVID-19 will be with us for some time, and we want residents to know that we are doing our best to provide accurate, timely, and helpful information to keep all of you safe in the days, weeks, and months to come. Next, we want to note that the Nebraska Air National Guard has scheduled a statewide flyover salute to healthcare professionals and all Nebraskans who are responding to the coronavirus pandemic, and that'll be on Wednesday. A KC-135 Stratotanker from the 155th Air Refueling Wing, based out of the Lincoln Air National Guard Base, will fly over 14 hospitals across the state to deliver the salute, beginning at the Regional West Medical Center in Scotts Bluff at 11:32 a.m., and ending over CHI St. Elizabeth and Bryan West Campus in Lincoln at 2:45 p.m. And with that, we'd love to open it up for questions from the media. Any questions today?
Riley from the Journal Star here.
Hi, Riley.
Hi. Can the health department confirm a handful of cases at Madonna? We heard that there had been about 5 cases reported.
Director Lopez will come take that question.
Thank you.
Riley, I can't really confirm that right now. We still are doing some investigations, and I'm not sure that we're ready to come forward with the final results of the case contact tracing.
A follow-up question, since this topic has been in the news lately, but when it comes to the Smithfield Crete outbreak that you've been reporting on, is your plan to continue reporting on cases that you and your staff identify connected to that outbreak? I know the governor has sort of instructed other health departments to use caution in reporting it, because if they can't tie them specifically, those cases to the plants. Do you have thoughts on that?
Well, I'm not sure. I didn't hear the governor's briefing, but I've heard some of that. And I think what the governor was cautioning about was reporting in aggregate data, and making sure that you're able to clearly identify where the outbreak is occurring. We just know that these individuals are employed at Smithfield plant. That we have verified, and we're talking about their family members. So feel comfortable with that. I think at some point, as more and more individuals are tested there, that probably will change on how we report. But right now, with the cases going up in Lincoln, we have to keep the community informed about what's really happening so that we can all take the appropriate precautions, and individuals know if they have symptoms, they should seek assistance and get help.
Can you give any more details about the case, the fatal case today? Was that a known individual, and did the death occur today, or is this sort of delayed report?
It's a delayed report. As I think I said earlier in our talk today, that we always want to make sure our data is always confirmed and very accurate. So we had to go through a process to see what the current situation with that individual was and confirm it was actually a COVID-19 related death.
Was it outside of a hospital?
The person was seeking emergency care.
Gotcha. So they're a very new case, and not like previous cases where they had been hospitalized for a prolonged period of time.
Correct. That's correct, Riley.
Thank you.
Any other questions today?
Mayor, this is Bill with 1011. I wanted to clarify something. The social gathering rules here in Lincoln extend through June 30th. Is that correct?
Correct.
With that being said,
the limitation to 10 or fewer.
With that being said, would you have a message for bar owners tonight who maybe say they've been treated unfairly compared to restaurant owners, and whether realistically they should probably expect to be closed another month and a half?
I'll let Director Lopez come speak to this. We know that this is a difficult time for everyone in our community, and particularly those who've been impacted by directed health measures. We also know that there's a direct connection between public health and our economic recovery. And we're trying our best to make sure that as things do ease, as restrictions are relaxed, that we won't have to reimpose them. And so taking it slow, being cautious, and working to contain this virus is absolutely essential to then, once we do relax our measures, have a better success rate at moving forward. What we don't want to have to do is regress. But we recognize, and I want everyone in the public to understand, is that this virus is novel. There is no vaccine at this time. And we're going to be living with it in our midst. So we're going to have to be employing smart strategies to contain and mitigate its spread. And there is a potential, as long as we are living together in community with one another, for us to make choices that help prevent the spread or choices that are more likely to increase it. We're asking everyone to make good, smart choices that can help us prevent the spread, because until there is a vaccine, the possibility of future outbreaks remains. So this is really going to take all of us. And it is very difficult, of course, to be one of the businesses directly impacted, but we will continue to work with them to hear their input and concerns and work to try to do everything we can to support their safe resumption of operations as quickly as we're able to do so. And with that, I'll let Director Lopez come do a follow-up.
Good afternoon, Bill. I think when we first were talking about the directive health measures, the reason that bars that don't serve food, that aren't a food establishment, were held out and are remaining closed is because of the socialization aspect of spending a longer period of time sitting in the bar and multiple different people present. You know, the purpose of going to the bar is primarily the socialization and having a drink with others. And just like going into a restaurant, though, and eating with others, once you eat and you may have a drink with your meal or whatever, you do that and then you move on. You're not sitting there for an extended period of time. So that was the rationale behind that.
Any other questions?
Mayor, I would have one more follow-up dealing with sports from yesterday. Are coaches able to reserve fields right now for the month of June through Lincoln Parks and Rec?
You know, right now our fields are closed and our playgrounds are closed. And so at this point, that's what I can tell you.
Thank you.
Any other questions? All right, thank you so much. Thank you to all of our cultural center and community leaders for sharing their messages and for being a part of an incredible leadership team in our city. Thank you to all of you for tuning in and learning more about how you can protect yourself, your loved ones, and our community. We'll be back tomorrow with more information at 3:30. Take care.